We might get started. Welcome to the April edition of the Implementation Science Interest Group. Is that somebody else joining? Yeah, there's a few more people joining. All right. Okay, so I'm going to be chairing this session today. I'm Yvonne Zirinsky. I'm Professor of Health System Sustainability at the Australian Institute of Health Innovation at Macquarie University. And just a reminder that we are recording this meeting and it will be posted and made available on the AIHI YouTube channel. So if there are any issues with that, can I suggest that you contact Shalini and just let her know, and we'll make sure we edit you out if you don't want to be seen or heard. All right, so just before we introduce Rebecca, our fantastic speaker, I'd like to ask Shalini to please do the acknowledgement of country. Shalini.
Okay, so I acknowledge the traditional custodians of the Macquarie University lands, the Wadawurrung clan of the Darug Nation, whose cultures and customs have nurtured and continue to nurture this land since the Dreamtime. We pay our respects to elders past, present and future. Back to you, Yvonne.
Thank you very much. So we are really happy to have Rebecca Haddock with us today. Rebecca is Executive Director for Knowledge Exchange at the Australian Healthcare and Hospitals Association, AHHA, where she leads the work of the Deeble Institute for Health Policy Research. Now, Rebecca has about 20 years experience in the university, government and non-government health and science sectors. She has a PhD and she's a results-driven executive known for leadership, strategic engagement and translating research into actionable insights for government, university and industry stakeholders. And I imagine that a lot of people on the call have similar aims, is that they want to have their research translated into action, into policy, into practice. So it's really fantastic that Rebecca has agreed to talk to us, and she has a slightly provocative title, Academics Can Change the World. If only they could stop talking to their peers. Just a reminder that Rebecca will probably speak for about 25 minutes, and then it's an open question time. Please type your questions into the chat or just save your questions for later. It's fairly informal, so at the end, just unmute yourselves and ask questions. We really want this to be interactive and to have a good discussion at the end. All right, I'll hand over to Rebecca. Thank you.
Thanks, Yvonne. So before I kick off, I was going to just, you've heard my background, but I'll give you a little story around that. So I was an academic researcher for about 15 years in medical research. And when I left academia, I worked at the Therapeutic Goods Administration as an evaluator, a regulator. So I had experience in regulation. And then I moved to the NHMRC, where I was working on dementia research policy. And it was while I was at the NHMRC that I saw a really big disconnect between all this amazing evidence that academics were providing and actually what was happening in government. And so I was fortunate enough to get the role at the AHHA, where through their membership of health service providers and universities, we were really able to translate that evidence into meaningful action. And so I think for me, it was that aha moment of recognizing that actually you need a tripartite environment in order to get good research translation. So I'll share my screen now. Sorry, it always takes me a moment to drive these things. Can I ask, are you seeing the presentation or the,
No, it's blank, Rebecca.
it's blank?
We tried it before and it worked.
Okay. Oh, I'm sorry about this.
That's okay, don't worry.
I'll try again. Okay. Can you see anything now, Yvonne?
Yes, yeah, that's right. Perfect. Perfect.
Yes?
Yep. Beautiful.
Okay. All right, now we can kick off. So I'd also like to acknowledge the traditional owners of the lands which I am joining you from, the Ngunnawal people, and pay my respect to their elders past and present. So there are about 30,000 academic journals published, that exist, with around 2 million peer-reviewed articles published annually. And each, paper takes around 9 to 12 months to actually be published. The average peer-reviewed journal is read completely by no more than 10 people. And if you're a bit like me, one would be your mum and one would be your supervisor. So the reality is that peer-reviewed journal articles aren't actually being read really widely. And there's an actual very real view from Canberra that researchers are so focused on methodological purity that they run the risk of ending up with a perfect answer to the wrong question, often years later than the answer was actually needed. And we have all heard that sort of, it takes 17 years from publication to actually getting it into policy. But I'm going to argue with you that that is actually not the case. The other thing I just wanted to flag right at the beginning, that government views preprints with caution. During COVID, there were around 2,000 articles, 200,000 articles on COVID alone, and it's estimated that around 30,000 of these were preprints, and they're really viewed with caution. And when you speak to the policymakers in government, they really expect things to be published quite rapidly after they've received the information. So it's something to just bear in mind. Also, I just want to say, please feel free to stop me if you have a question during the session as well. So the notions of evidence really differ between academics and policymakers. So for academics, evidence really is quite scientific. It's proven empirically, it's theoretically driven. It takes as long as it takes, and by that I mean usually within a grant cycle, but and there are a number of caveats and qualifications in what's published. For policymakers, anything that's colloquial, anything that seems reasonable is policy relevant, timely, and has a clear message. Okay, so I just want you to bear this in mind as we move through the rest of the slides. So how is evidence actually used in policy making? Well, beliefs, potential effects, and political context are often more compelling than evidence. Policies aren't always made in a vacuum, and the use of evidence is really set alongside consideration of what is popular or at least acceptable to the population. So for evidence to actually discharge function, it needs to be the right evidence, it needs to occur at the right time, and it needs to be seen by the right people. And I think that's a really critical thing to remember. So we'll come back to that one as well. So who wins, who loses, and who will fight, really significant determinants of policy making. So I have a little clip that I want to share with you, which is I've always used it as a realistic example of what it's like to work with policymakers. And I was actually showing this video to another university, and it turns out it was based on a real life experience that they'd actually had. So it was a really great example. So please let me know if you can't hear it.
Now all the opinion pieces are rolling in, so
That's certainly caused quite a stir at the department.
has it?
We're chomping at the bit.
Is that right?
This is what they live for. Major long-term policy.
Well, that's what the PM wants.
Spoke to him last night.
I gave you a call.
He did. And he's certainly keen to seize the momentum.
Well, he wants to get something up.
That's come through loud and clear.
Yeah, can do. Yeah, well, some opening remarks. Obesity. The Prime Minister has decided that it is now a policy priority and he wants input from the department. As much as you can give, he wants to seize the momentum and really get something substantial up. Okay? Can do. Okay? Philip.
Thanks, Tony. Now, Warren and I, of course, have spoken to our opposite numbers in health.
Excellent.
I can tell you from their perspective, they think obesity could soon become this country's biggest health crisis.
Oh, that's excellent news. That's wonderful news. That we're getting onto it early.
Anyway, we got together, the two of us, burnt the midnight oil, as it were, and we think we've come up with a proposal.
Excellent. Let's hear some solutions.
I think we start with a task force.
Aha.
Interdepartmental, review all the options, all the current evidence,
This is sounding good.
speak to the relevant stakeholders.
This is excellent. Just grab a pen. Holly, can I just grab a pen off you? Yeah, sure. Thank you. Thank you. Yeah, speak to all the stakeholders. Keep going, Warren.
And come up with a provisional policy proposal and implementation strategy.
This is exactly what I wanted to hear. And how long will all this take?
Well, of course, we know the PM's identified this as a policy priority.
Yep, tick.
Realistically, I think we could have something ready to go within 12 to 18.
Okay, 12 to 18 days. Okay. Holly, can I just grab my diary?
No, Tony.
Yeah?
Months.
What?
12 to 18 months.
Probably 18.
Probably 18.
And next year's diary as well. Months.
If we're trying to come up with a substantive public health initiative that addresses obesity,
Oh, sorry.
Yeah.
then I think it will take 18 months.
Now, you see, you seem disappointed.
Oh, the biggest loser get it all done in 10 weeks.
I think we might be talking a few more stakeholders in a major policy initiative like this.
Well, they start with 20, Philip, and they still get amazing
all right.
results.
And I know Warren's going to have a heart attack when he hears this.
Uh-oh.
9 months, but that's flat chat. Fast-tracked, all stops out.
Yeah, I think what Tony's saying is, what if we had something a little less comprehensive?
That's what I'm saying.
Gentlemen, we have a saying in the public service.
Is this frank and fearless thing? Because I've never quite
No,
got that.
it's not that one. Policy on the run is policy underdone.
Right. See, I don't get that either.
If we're serious about implementing...
Look, if you had just seen the clippings from yesterday, I mean, people are
All
really
right,
responding
Tony,
to the
Tony,
PM and what he's...
Tony, we've got a choice here.
Do we?
We can come up with a serious policy framework incorporating all the latest science,
And that's the 18 months one.
or we can take the populist route. Superficial responses to the latest whims of the general public.
No, we don't want... Just for interest's sake, how long would that take?
It's a great clip. Okay, so where are we sitting in terms of how academics are viewed by policymakers? Well, we know that policymakers are genuinely concerned about that methodological purity. Not that there's anything wrong with it, but they're worried about the length of times involved. We also know that they view evidence in a slightly different way and how they can leverage it. And we also know that there's sort of this realistic situation where if they've got the evidence and they can go with it, they will. If they don't, they will go anyway. So, as I just said, research-based evidence is really not alone not sufficient to determine a policy direction, and politics almost always trumps evidence. So, for example, the sugar tax. So despite mountains of evidence pointing to the public health benefits of adopting this fiscal approach, powerful vested interests have really muddied the waters and convinced politicians to go against prevailing evidence. So in fact, a spokesperson for the former Health Minister, Greg Hunt, has actually said that the government didn't want to be responsible for lifting the grocery bill for Australian families. So there's an issue that's twofold. So a move for a sugar tax would actually be political poison in Queensland, where 95% of our sugar is grown. And the industry employs around 16,000 people and raises $2 billion in export dollars. Except the evidence has actually shown that around 80% of Australia's domestic sugar production goes overseas and around only 5% goes into sugary drinks. So the other piece around this is that elected representatives really have to weigh the pros and cons of things like new taxes, but they're not helped in the nutrition space by deliberate global campaigns to seed doubt about the health risks of sugar. So Coca-Cola itself has spent millions funding researchers to tell the public that a lack of exercise is worse for you than sugar, despite, you know, the growing chorus of health professionals and independent nutrition scientists advising overweight people against, you know, trying to run off a bad diet. So, as I said, that there'll always be, you know, evidence, but the politics will always trump evidence. So what are some of the realities of policy making? What are you as implementation scientists really looking to work, the environment you're looking to work into? So policymakers obviously have many stakeholders and they need to balance like many perspectives. So that includes the political, financial, social, economic, technical and environmental. And really policies are developed and they change on the basis of the underlying beliefs about the cause of a problem. So belief, not evidence. The potential effects of an intervention and the consideration of the social and political context in which the action is taken. So here's a snapshot of a political landscape. And the reason I like to show this is because elected representatives, you know, they're in Parliament to represent their constituents and they're always concerned about the issues affecting their constituents and issues relating to healthcare within their own electorates. So elected representatives want to hear from their constituents and they want to respond to the needs of the constituents. And this means understanding the background, interests and parliamentary responsibilities of your elected representatives and building a relationship with them to gain support for the work you want to do. So, for example, Pat Dodson here, he's no longer in, but he had the largest population of Aboriginal and Torres Strait Islanders in his electorate. Kevin Anderson in Tamworth, okay, his electorate has the most overweight population in Australia. So even though his portfolio may not be on health, he has a particular interest in chronic disease. Likewise, so there's a lot of, more than ever, there are a number of working mums in Parliament, so they're particularly concerned about that. And for example, Jackie Lambie, so she was in the, she's an army veteran in the military police, and she had a medical discharge due to a back injury and that led to depression. So she has an interest in military health, mental health, you know, so beyond their own portfolios, politicians really have an interest in what their constituents are up to. And I'll give you a working, somewhat embarrassing example. When I very first started out on this working in the knowledge exchange space, I went up to speak to the health minister and about obesity, the impact of obesity on blood pressure. And I was all excited. I went up there, I gave my spiel, they were interested, and then they asked me what the incidence of obesity in their own constituency was, and I didn't know. And I could just watch their face glaze over. And so it's really important to understand that beyond their own portfolios, they actually have a big interest in health. So I'd like to say I followed that up with the information. That's really critical as well, if you don't know something, to follow it up. The other example I'll give you, which will all be a bit closer to home, in 2018, $500 million was actually granted to Mackenzie's mission through the MRFF to allow up to 10,000 Australians to get access to free pre-pregnancy screening for spinal muscular atrophy. So the catch with all of that, there's nothing wrong with that, but the catch with all of that was that Mackenzie's grandfather worked at Parliament House and he'd chat to the then Health Minister Hunt in the corridor. So you can see that politicians are actually really swayed by personal stories as well. So what's the other reality that you're working in? So the other reality, there's been some big changes post-COVID to how health governance is occurring. And so obviously they've gotten rid of the Council of Australian Governments. And what that actually did was removed some of that level of transparency that allowed information to flow from government through to health decision makers and into the advisory groups. So this loss of transparency also, what we saw was that ARMAC, the Australian Health Ministers Advisory Council, also became the Health Chief Executives Forum, okay? And so now we have slightly different a governance mechanism that is less transparent. There's potential conflicts of interest and a real lack of scrutiny that's occurring at the governance level. So how do you as academics actually get buy-in into government if they, sometimes view evidence with skepticism? They, they have their own personal beliefs that can sway the use of evidence in policy making. And we have a governance environment that is not as transparent or straightforward as it was prior to COVID. Well, there are a number of key government documents that you can actually use to align your work that will help get like really good cut through with government. And the first one, believe it or not, is from Prime Minister and Cabinet, which is their the government's corporate plan. And so the government's corporate plan, I've put all the links in for you, and I can share the slides with you. The government's corporate plan in the health outlines 6 key areas of policy that they want you to follow. And so the health, one of the sections in health is around delivering better care. So fixing aged care, the NDIS, and strengthening universal healthcare through Medicare, so primary care. So the reason I wanted to show you this was if you can align your work with this key policy document, then government will already be listening. So it's really important, like if you can do that, it's a good move. The other key documents that are really important, which you've probably all seen, are the addendum to the National Health Reform Agreement and the Long-Term Health Reforms Roadmap. So again, if you can look at these documents and align any of your work to these, you'll already have a receptive ear with government. So the other reality of policy making is that they're really busy and they don't have time to read the long reports and academic papers. And an example of that was I was speaking to one of the senators, and she picked up our paper. She looked at the table of contents and she said, yep, I'll read that, and put it in a pile, okay? Otherwise, they just, they don't have time to read these long reports. The other thing is they're not subject specialists, so they don't really understand any complicated explanations or jargon. So you really have to bring back what you're writing to a really basic level, and they often have conflicting sources of information. So they really want it presented clearly and concisely, and they're more likely to read something that looks attractive and it appears interesting and it's short and easy to read. So I just have another clip to show you the kind of reality that you are working in and why you have to get your information across really clearly and quickly and precisely.
Now joining us live here in Canberra is Matt Keogh, Labor MP for Western Australia. Matt, thank you so much for your time.
Great to be with you.
What do you make of the super debate happening on the Liberal side of things? We've seen a bit of disagreement over whether that guarantee should be raised to 12%.
Yeah, well, it's division central in the Liberal Party yet again, and now it's superannuation because they're...
Matt, apologies, we've got to interrupt. You've got to go to vote. You've got to go to the House of Reps.
I've got to go do my job.
Division. We'll talk to you soon.
I'll be back.
We'll take a picture. Taking you live now. These are pictures coming to us from the House of Representatives where that division continues. We had our Interview with Matt Keogh rudely interrupted. The Shadow Minister for Defence Industry had to run down to the Green Chamber for that division.
And now we're going back to Matt Keogh, who had to abruptly leave our studio to go for a division. Did you make it?
I made it. I'm back.
Excellent. So big news this week, your Defence Industries, it's a big portfolio for you.
Huge.
Yeah, and you got to have your first trip out onto Talisman Sabre.
I did. So Talisman Sabre is the main exercise between Australia and the US, really looking at their interoperability. There's over 30,000 troops, sailors, airmen and women involved in the exercise. It's a really amazing opportunity to get out, and what's really useful for me is in Defence Industries not only to go and meet with Joint Command and those people at the top of the Defence Force, but also talk to people at all levels and ranks.
Matt Keogh, we are going to interrupt you now. We've got to go to the Prime Minister.
Well, okay.
This interview is not meant to happen. Talk to you soon.
Okay, so
Now joining us live.
the point I wanted to really make with that slide was you're working in an environment where you're going to speak with policymakers and they can have to get up and run out of the room. And so that's happened to me on numerous occasions. So you really may only get 30 seconds to get your message across to a policymaker. So you have to be really clear what you want to say and you have to have it prioritised. So who are the power brokers that you want to work with? So a power broker, directly or indirectly wields political power by influencing the outcomes of elections or government policies, by influencing, having influence over key decision makers. We often term them in Canberra the men in grey suits, but they all wear all kinds of suits, but they're not usually motivated by ideals or policy goals, but rather as someone who accepts politics as like a power struggle. And so they know how to get things done amidst that struggle. So a successful power broker has an enormous network of friends and allies and is constantly involved in deals and favours. So who are the power brokers at that Commonwealth level? Well, we've obviously got, ministers, shadow ministers, crossbenchers, committees. So often you can influence, academics can have a lot of influence at the committee level, and the way to get involved in that, I've put the links in here. And of course, within the Minister's office, you've got the Chief of Staff and advisors, and I'll touch briefly on advisors. I know I've only got a couple more minutes, but I'll get to that. And of course, the Department of Health. So again, they've got I think it's the next slide. So political parties. So when you're thinking about approaching that federal level, it's really important to recognise that the political parties, what can they actually offer you? So they all play a different role in the Australian political sphere, and it's really important to be non-partisan, no matter what your own political beliefs are, because that sort of helps build trust, which is the real crux of any relationship when you're trying to do knowledge exchange. And so just be aware that the different parties have different different activities that you can tap into. So advisors are really key people to actually build relationships with. So everyone thinks, I have to speak to a parliamentarian, right? But for every 5 minutes, an MP can give you, an advisor can give you 30 minutes. And that's not an exaggeration. But the thing is, they don't necessarily have topic knowledge, but what they do have are skills, influence, and access. So remember that those skills aren't necessarily yours, but they're complementary to yours. So that's why advisors are so key in actually getting information across into policy. And so I was fortunate enough to be at a meeting with the Health Minister's advisor when Mark Butler first came into his position, and the chief advisor actually had come from a completely different portfolio and didn't know a lot about the health system. And so we were able to provide him with an overview of the health system. And that's, you want to be seen as really, really dependable. So Department of Health, the Federal Department of Health, you know, responsibilities for making policy can reside within more than one section or even across different departments. So it's really can be really difficult to identify who you want to be talking to in a particular area. And the other thing to note is that there's a huge amount of turnover since the Labor government came in. You know, we have to check the org charts every couple of months to see who's moved, and they have really hectic schedules. And so they don't have a lot of time to read academic research, particularly if it's behind a paywall. They really struggle to find time to look at anything that's not directly relevant to their immediate workloads. At the state level, of course, we have state government, lobbyists and commercial interests, other peak bodies, and the media at Parliament House actually has a huge amount of influence. So if you can talk to the media at Parliament House, like that's a real step in the door. I showed you the org charts for the federal Department of Health, but of course you will have org charts for state health departments. They're actually harder to find. They don't always identify who the person you need to find, the names of the people you need to talk to. So it can be a little bit trickier. Yvonne, do I have a couple more minutes?
Yeah, maybe try and wrap it up in the next 5 minutes or so.
Yeah, sure. I think I've only got 2 slides left, I think. Okay. So the other thing I just want to say, and I'm sure you're all great at it, but clarity of information is super, super important. You need to be really, really clear about what you are the information you're providing to policymakers, and also be really clear about what you don't know and when you will potentially have those answers. And I gave you the example of me going to see the health minister and not having an answer to something. Always follow up, always follow up. And I wanted to show you this little clip of Scott Morrison at the beginning of the pandemic, because you will see how confusing the lack of clarity of information is for policymakers. And I'll just play a bit of it for you.
Right now, there is no community transmission going on in Australia of the coronavirus. This is about staying prepared. This is about assuring people that we've got this, we're prepared for it. So you can go to the footy, you can go out to the Chinese restaurant, and in fact I encourage you to. And so when it comes to people going about their daily business, I would encourage them to continue to do just that. If someone is in a rural and regional area, you know, there isn't the same access to Uber Eats, for example, there might be in city. I'm going to the footy this weekend and I'm looking forward to it. And I'm sure many Australians would, and I encourage you. We will impose a universal precautionary self-isolation requirement on all international arrivals to Australia, and that is effective from midnight tonight. It's ridiculous, it's un-Australian, and it must stop. And I would ask people to do the right thing by each other in getting a handle on these sorts of practices. We all love our kids, and there's nothing we wouldn't do for them. And I'm telling you that as a father, I'm happy for my kids to go to school. Keeping a healthy physical distance from one another. This is one of our most, if not our most important weapon against the spread of the coronavirus, which means we can save lives. But, Andrew, I'm sorry, you've had several questions. Andrew, I'm sorry. Andrew, I know, but you don't run the press conference, okay? What we saw was a disregard of those social distancing practices. As people turned up to the beach in large numbers, crammed venues in our major cities, we faced this unprecedented challenge. A once-in-a-100-year event. A global health pandemic that has fast become an economic crisis, the likes of which we have not seen since the Great Depression. Right now,
I'm just going to stop it there. But what I really wanted you to get out of that clip was his lack of clarity around the particular topic, COVID, was really creating confusion among the general public. So you've got to provide, even though the information was moving really rapidly, it has to be really clear and provide a direction for policymakers. So the last thing I'll just end with is around influencing public policy. So a number of surveys done of looking at the level of trust that different professions are viewed with. And so you can see up the top here, nurses, doctors, pharmacists, even university lecturers here, you know, they're all the most trusted professions. And when we've done not we personally, sorry, when there's been an analysis of health ministers' diaries to look at the interaction between health ministers and advocacy organisations, what they actually found was the AMA had the greatest number of interactions with health ministers over a 5-year period, but and they're also high on the public trust score. And so what you really want to be doing is building alliances, and this study was done in 2019, so to take that with a grain of salt, but you really want to be looking to align yourselves with trusted professions and trusted advocacy groups, and then you get that double whammy of being able to actually get your foot in the door with government stakeholders. But the other thing really important to note is that actually above the medical professions, private hospitals and rugby league associations were the most dominant advocates in some of the states. So that's something to bear in mind. Maybe if you're doing an opening, invite an NRL player. So I'll leave it there. I guess to summarise, it's really about knowing that evidence is really, really critical in policy making, but it's got to be there at the right time, in the right format, and discharging the right information. So I'm happy to take any questions.
Thank you, Rebecca. That's excellent. And it's really, you know, it's the reality, isn't it, that evidence is just one of the pieces that is considered in policy making. And of course, we all want our papers to be read by politicians and by bureaucrats, but it doesn't happen that way.
No.
Any questions for Rebecca? Yeah, Seamus, just unmute yourself and go for it.
Thank you, Rebecca, for an amazing presentation. A little bit disturbing, if I'm honest. Perhaps not surprising, those insights into how the sort of political policy-making process works. But I just had a question in terms of something that perhaps could be defined as fitting within policy or perhaps slightly ancillary to it. And that is the sort of documents that are released by the Australian Government Department of Health that tend to not be called policies per se, but tend to be called national strategies or frameworks. You know, for example, there was one on heart disease and stroke in the last couple of years. And these documents tend to be, as I said, published by the Department of Health, but often put together by working groups where the medical professions and researchers kind of feature fairly heavily. And they often do synthesize evidence to a high degree, up to the kind of rigor that academics expect. And yeah, I was just wondering your thoughts on how that type of activity fits within what you're talking about more broadly. I mean, I can appreciate your point about like a sugar tax is a really clear-cut example of a policy that's governmental, it affects something that affects health, but it's really like a rule or a regulation that's a really clear example. But what about that other sort of space? How does that fit in within what you're talking about?
So the frameworks really, we view them as like they're like a direction, like they're trying to push the sector in a particular direction. And the reason why they're not usually more prescriptive policies is because they don't have funding attached to them. And so when we read like a framework or a strategy, it's missing the money behind it. And so the intent is that actually you're going to have other stakeholders delivering on those particular frameworks or strategies. And with that, they'll be putting in the money. That's basically it is. So you actually have to look, we've got the budget coming up. And so what you actually need to do, there's lots of moving parts, obviously. We will look at the budget and analyse the budget and see where the money has been put into those frameworks, okay, to deliver on what's actually in them. And so that seems to be the latest. I have to say the government's pretty good at listening to stakeholders, but obviously there's not that money to go with it.
So I've got 3 other hands up. Mila first, then Samantha, and then Delia. So Mila.
Hi, thank you, Rebecca, for amazing presentation. I can't begin to explain it how timely it is for myself. I currently sit in a policy and research national project role, and the question for you, maybe a little bit off the topic, is around. I guess your slides really capture the internal struggle between the policy and research, and when they're embedded in one, you end up not belonging on either side. So is there a sweet spot, and what are some of the, I guess, support or the strategies people can find? So sitting within the department or a public sector, it tends to be very policy focused, but you have a portfolio of research to be responsible for, but it's basically let's move along. So it's kind of one has to give. Yeah, just to hear your thoughts on that. Thank you.
I think the sweet spot actually sits in your communications. And so if you want to really get evidence into that policy space, it's about having the information ready to go in a format that's digestible. And that's what I was saying right at the beginning. It doesn't have to take 17 years. You just have to be prepared to let go of it being absolutely perfect, and just be ready to go. Like and keep your ear to the ground. So you want to be reading the news and following everything that's going on in your space, so that if they're saying, if government's calling for something in particular, you can actually go, well, I've got something I can provide to them. That's all you've got to do. Just get it to them when, like, at the time. It's got to be timely. I think that's my biggest piece of advice: timely and really clearly communicated. I'm not sure I answered your question, but that's the sweet spot. You've got to be able to communicate it.
You have to a point. I guess it depends a little bit on the context of the topic you're working in. So perhaps it's in some other forms it was described as an idea whose time has come. So you might invest years and years of background research and producing evidence, and then it is just a pivotal moment. And I think it was described with the vaping. So for years there was a body of research, and then once it became a hot topic, people that were operating in that space were ready to go. So I think it's a combination of things.
I think also, it really is about getting the way I kind of describe it to people is you've got your thesis, which you distill down to a peer-reviewed paper, which you distill down to like an abstract, which you distill down to a tweet. Okay, so it's the tweet that they want to get. So that's you've got to make sure that tweet has as much punch as you possibly can, because you're working in this really rapid environment. Okay, it's not that they will go with the evidence if they've got it. I don't want you to think that they're dismissing all the evidence, but they've got to have it in a format that's good for them. It's like you take 3 or 4 years to learn the language of health of research when you're doing your PhD. Well, they've got their own language of policy, and they're not going to budge. Right? Academics have to come to the party.
It's interesting that actually personal stories have a lot of influence as well. So hearing those stories, the Mackenzie's mission.
Yeah.
That's a personal story that changed.
Personal story.
Yeah.
I mean, rightly or wrongly, I think, peer funding should be peer reviewed, but that's a true story. It's a true story.
Samantha, you're next.
Thanks, everyone. Rebecca, that was fantastic. Thank you so much for your presentation. I've got a left of field question as well. Do you have any advice? So I'm starting to do some research with policymakers about how to using this idea of living evidence and deciding when and how to use it best. And I just wonder if you have any advice for doing research with policymakers and how to do that well.
But best advice I can give you is use them to inform the development of your work. So you go to them and you say, look, we think this is a problem, or we have this evidence. You tap into where they see the gaps, what information they want. And it literally, you can say to them, where are your gaps? What evidence do you actually need? Like, we have those very frank conversations with them, and then provide them with that evidence. And sometimes it's not the evidence you think they want or need, or but it's get them that evidence. And I think it's really important to be unbiased in the evidence that you're presenting. And so if you have a big chunk of evidence that's going off in a particular direction, but actually you have you've got contradictory findings, present that as well. What you really need to do is build trust, and that trust comes with presenting like really unbiased evidence. And so that's my best advice. And not only so, you want to go to them at the beginning and find out what they need, but also go to them at the end when you've developed the research and actually say, this is what we found, you know, do you want to make any comments on it? We're going to release it to the public. You don't want to blindside them. And so just keep them informed of everything that's going on.
Perfect, thank you.
It's interesting, isn't it? Because, you know, we all want to work with policymakers, but some of the first things that they say to you, well, what do you need from me? You know, and they're time poor. So you have to be really clear about what the ask is. What are you actually asking me to do in this project? You know, am I providing high-level policy advice, or do you want me to do some nitty-gritty stuff? And usually they don't want to be involved in your, you know, your research process.
No.
They want to provide that higher policy overview for you, which is actually really useful.
It is.
Delia.
Thanks, Rebecca. That was great. And I mean, just some of the guidance you've given us. The one I've jotted down on my screen here is about the different strategies and documents and plans that you think that we should make sure that we align our research grants or our work with. So thanks for that. I'm just really interested in the whole area of kind of corporate determinants of health and state capture, and you kind of touched on that as well. And I'm just wondering, I mean, how one counters that. That example you gave of sugar-sweetened beverages was really great. It was an example. I mean, the pharmaceutical companies, there's lots of different areas, you know, the e-vaping people or whatever it is. And I was wondering, I mean, there's such strong lobby groups. I mean, how do we as kind of health researchers who are wanting to kind of, I guess, have some, we kind of have, I mean, for sugar-sweetened beverages, we have the evidence.
Yeah.
You know, we have the evidence from other countries. We have the, I mean, yeah, they don't have the Queensland sugar industry, I know, but I just wonder, sort of, how can one break that that lobbying power?
I don't have a clear-cut answer for you. I mean, particularly with that example, they've got the evidence, right? So that where it boils down to, politics will always trump evidence. It doesn't matter what you do.
Yep.
I'm afraid that's the answer. Like, like sometimes it'll just be on where the votes are going to go. I mean, these people want to stay in power, essentially, right? So that's what it really boils down to.
Thanks for that.
Yeah, look, unfortunately, I don't have another answer.
I suspected it was that, yes.
Yeah, I mean, to be fair, they will go with evidence if they have it. But there are a few particular sticking points, like that one, which I think is a great example to show you that it doesn't matter what you do. Right?
I think something I took away really strongly from your talk as well, sorry, but I won't talk again after this, was just the importance of, like with our research doing partnerships with policy, you know, people from the department, people from advocacy groups. I mean, including, you know, it's a collective research effort, and I think that really works well.
So you're all members of the Deeble Institute, and we can always help with that kind of connection.
Oh, great.
It's our bread and butter. That's what we do.
The Deeble does amazing work around policy briefs, and they create, you know, those really clear summaries and messages that actually do filter through to government and to policymakers. So yeah, it's really worth including the Deeble in your work. But Rebecca, I want to take you to the issue of time, you know, the complaint that it takes forever for us to do anything. Well, it does, because there's very little funding. If we had lots of funding, we could get stuff done more quickly.
Yep.
And also, our funders take a long time to assess our grants, you know.
Yep.
I'm putting a grant in now. I won't know the outcome until December.
Yep.
So it's, you know, I think policymakers need to understand that side of things as well. So it's the system that prevents us from actually moving
look,
more quickly.
they are cognizant of it, but I would say to you, so most of your grants, you've already done some of the work, right? So that's the bit that you need to be talking to them about, and just going without that sort of, like, if you can get your foot in the door, like, it'll be easier to, and government's on board, it's easier to get the money, right? So
yeah.
And
Yeah, I mean, it's forming those coalitions.
They are aware that there's a problem, but until you're actually sitting in academia waiting for that grant announcement on 2 days before Christmas, you know, you don't really understand what it's like.
Yeah.
So I think it's about packaging what you have got. Like, you can go to government and say, we think this is a problem. Do you think it's a problem? Where do you see it as a problem? Without actually having done any of the research.
Yeah.
The core bit of the research, right? But then now you've actually been informed by what they're looking for, and you can direct your work a little bit more. Look, it's not an easy fix. The system's kind of a bit broken.
Yeah, but I think the answer is including them in your planning.
I think the co-design, I think really to have it beautifully co-designed, you want to be talking to the policymakers and the service providers, right? Because, but right at the beginning, don't leave it until year 3 and say, I'm going to translate this paper for government. You want them right at the beginning.
All right. Any other questions for Rebecca? Well, we've got her. We've got another 5 minutes before we need to close off. Seamus, you've got your hand up again. Go for it.
I do, yeah. Sorry, is that all right? Just one more
Absolutely.
quick question. Yeah, just really valuable everything you're suggesting, Rebecca. I just was curious, though. One reason I mentioned those strategic frameworks in my earlier question is it seems as though sometimes in the process of research translation, and sometimes the reason why it takes so many years for evidence to be translated into practice is because it seems like partly through sometimes those strategic frameworks, but also other sort of activities, it seems that there can be an aim to actually consolidate evidence at the level of the systematic review, for example. So they're doing a really fantastic bit of research and producing evidence for the efficacy or effectiveness of some clinical intervention. Generally is not enough. Normally it sort of gets perhaps folded into systematic review, and then that itself gets folded into something like clinical practice guidelines. So yeah, I suppose I'm just trying to phrase this question right. I mean, we actually, where I work, we conducted a roundtable recently on stroke prevention and brought in all stakeholders, researchers, clinicians, policymakers. It was very interesting to hear the diversity and how different everyone's views was. And a real tension that emerged, and it was an unresolved tension really, was some researchers going, we still need to focus on generating evidence of effectiveness and efficacy, and other researchers saying, no, we need to be realistic, look where the funding is, look at what the government's priorities are. There's kind of enough evidence, in a sense, even if we don't have perfect evidence for each individual intervention. We just need to focus on implementation now and trying to get funding for implementation studies. And that was kind of an unresolved tension. But yeah, I'm not sure exactly what question to ask, but I suppose just if you could speak to that tension or that difficulty that some researchers don't necessarily realize that they can do the best bit of evidence, but there can be these very, arcane pathways through which any bit of evidence has to go. So how does that fit in with what policy makers are looking for?
Yeah. So I personally believe that blue sky research is absolutely critically important. We need to be, having that capacity to have academic freedom of thought. Otherwise, we're never going to get the best innovation, right? So I'll put that out there. But also, it doesn't matter how much policy will go without evidence. That's the bottom line. And so you can have academic purists, but they're not going to be able to translate that well. And so the way I always look at it, it's it's a huge moving beast that you've got to consider, right? So I always look at the systems level and what frameworks and things are happening and movement that's happening at the systems level, but also a bottom-up approach is really important too. So what are the issues that are, you know, at that implementation end? And so how do you marry the two together? And it's literally about volume. You've got to hold so much information about what's going on. And so if you can just align yourself with some of those frameworks and then really scoop up what's happening at the ground level, then you end up actually with a really good solution for government, I think.
That's really good. That's really good
kind
advice.
of let some of that, it's really hard, like it's a real struggle to let it go, but you just have to go, this is what I've got right now. What does a policymaker need right now? Right? How does that match with what's needed on the ground? And the thing is, they want to know what's happening on the ground. They don't know. They really don't. And so if you can go to them and say, this is what we're seeing on the ground, they love it. They love it. They love case studies. They love stories. They love anything that you can put a human face to or an emotion or a feeling. They love it.
Yeah.
Thank you, Rebecca. And thank you, Seamus. There's just one comment here from Andrew Partington. He says, sugarcane biofuels will make way for sugar taxes. Economics trumps politics, trumps other types of evidence.
Yes.
Health economists speaking out.
I agree. I do agree. Yeah.
Seems that money talks.
Money does talk.
All right. I want to thank you again, Rebecca, on behalf of everyone online. This was a really fantastic session and a great discussion. Thank you, everyone, for contributing. If you know anyone who might be interested in viewing this will be on our YouTube channel, as I mentioned earlier. And thank you also to the team, the organising team, Shalini and Georgia. Thank you very much. And we will see you next month for another exciting discussion.
Thanks, everyone.
Thanks, everyone. Bye.